So the irrigation kit that you guys got, you got one in your kit. It says irrigation tray. Anytime you have a patient with any kind of enteral feeding, no matter what type of tube they're using, a nasogastric or a gastric tube, you have to have an irrigation kit. These are only good for 24 hours. When you open up the kit, basically what you're taking out is an empty container and a giant piston syringe that holds 60 mLs. Okay? I recommend when you open these up, you loosen the syringe and the plunger because they do stick, which will cause you to spray stuff everywhere. There are markings on the container so you can measure out exactly the amount that you need as well as the syringe. We're going to be using this to irrigate or flush the tube before we do anything, before we administer meds, before we administer feedings. We're also going to be using this to aspirate. We're going to pull back the gastric contents and we're going to measure them in here. In the hospital system, you're going to use usually a bottle of sterile water you'll get off the supply kit. At home, Judy's using good old-fashioned tap water. And I'm actually going to put some paper towel down because I will spill. Okay. So I'm just going to fill. Doesn't really matter how much you put in here. What matters is how much is in the syringe. So I've got some water in here. Typically we use 30 mLs. Most tubes, that's about how much it takes to flush the food through them. So 30 mLs is, a pretty good amount. So we'll just put our syringe in the bottle, draw up till we get 30 mLs. I got 40, so I'm going to first of all get some air out. So there's air in the top. I really don't want to put air in their stomach because that will just give them like air in their stomach, which is like gas pains. So if you pull your plunger back, get more air, all the fluid will get out of the tip of the syringe and you can push it up and get the air out. And then I can just push 10 mLs, I had too much in here, back into the container. And then I'm ready to use my irrigation kit. Again, this is good for 24 hours. You'll have a Sharpie in your pocket at all times. And when you open kits like this, you're going to take your Sharpie and put the date and the time and your initials on it so that everyone who comes in the room knows how old this is. Because after 24 hours, it's just going to be covered in bacteria. All right.